Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friends. Welcome to this week's episode of the Healing Pain Podcast. I am your host, Dr. Joe Tatta. It's great to be here with you. And thanks for joining and downloading this week's episode. On today's episode, we're discussing a new assessment tool to guide behavior change, which is called the Physical Therapy Healthy Lifestyle Appraisal. The Physical Therapy Healthy Lifestyle Appraisal was developed by Dr. MarySue Ingman, who you'll meet in a couple moments. And this is the first validated assessment tool for physical therapy practice where we can look at nutrition, physical activity, stress, sleep, and tobacco use. What I like and really appreciate about this tool is that it's quick, it's easy, it fits well into physical therapist practice, and especially fits well into physical therapist practice if you're using integrative or lifestyle medicine approaches to treat chronic pain or chronic disease management. Let me share a little bit about our guest this week. Dr. MarySue Ingman is an associate professor in the Doctorate of Physical Therapy program at St. Catherine University in St. Paul, Minnesota. Her research interests include the role of physical therapists in health promotion and clinical practice. She's published studies on motivational interviewing and the role of physical therapists in health promotion and wellness. On today's episode, you'll learn a lot about counseling, assessment, and the science of behavior change. And in fact, today's episode is actually a sneak peek into some work that all of us really have been working on for the last almost 2 years. Some of you may know that I co-edited a textbook. That textbook is called Integrative and Lifestyle Medicine in Physical Therapy. My co-editor was another physical therapist who you might know. Her name is Dr. Ginger Gardner. And in that textbook, we actually invited about 40 physical therapy professionals, researchers, and educators to contribute to this book on integrative and lifestyle medicine in physical therapy. Chapter 3 in this textbook, which is called Coaching, Counseling, and the Science of Behavior Change, was written by MarySue and her colleague, Dr. Janet Besner, who is a professor in the Department of Physical Therapy at Texas State University. That textbook is on track to come out in approximately August and maybe a little bit sooner. We are excited because we think that this will be useful for physical therapy educators, as well as clinicians who are using integrative and lifestyle medicine in physical therapy. And as I mentioned, chapter 3 is written by MarySue, where we really go into coaching, counseling, and behavior change, which is what we'll discuss on today's episode. Okay, without further ado, let's begin and let's learn about the Physical Therapy Healthy Lifestyle Appraisal and meet Dr. MarySue Ingman. Hi there, MarySue. Thanks for joining me this week on the Healing Pain Podcast.
Hi, Joe. Thanks for inviting me. I'm happy to be here.
I'm excited to speak with you this week about the role of the physical therapist in evaluating and screening for healthy lifestyle behaviors. I know this has been really a personal interest and a passion, and obviously a lot of your research focuses on this area over the last couple of probably decades for you. We're going to specifically be talking about a paper that you wrote that everyone can find in the April 22 edition of Cardiopulmonary Physical Therapy Journal. So it's a journal of cardiopulmonary physical therapy. And the title of that paper is The Development and Application of the Physical Therapy Healthy Lifestyle Appraisal, a new assessment tool to guide behavior change. It's a mouthful right there. I know we're going to dive into all the different parts of that. But I think a good place for us to start is, why did you decide to develop this tool? Healthy lifestyle is something that we hear about every day on the zeitgeist, but how does it really relate to us as physical therapists, and how can this tool help inform what we're doing each day as a physical therapist?
Yeah, great. It's a good place to start. So this is like you said, this has been a passion of mine. Health promotion and wellness has for a number of years, and particularly development of a tool to help clinicians and educators have an introduction of a way to start having conversations with patients about behavior change. But the process of this tool began with the co-authors, Dr. Janet Besner and Dr. Beth Black, and I. We've been probably for the last 10 plus years, have had the opportunity to teach on PT's role in health promotion and wellness to PTs and PTAs across the country in a lot of different venues. And so helping them recognize what's within our scope of practice in health promotion and wellness, what behaviors should we be talking to our patients about, and then how to have those conversations. Focused on theories of behavioral change and motivational interviewing. So I felt like we were really had a good impact and strong impact on bringing the importance of this to our PT colleagues. And we recognized that what was missing was a brief, quick, simple tool that would allow clinicians to be able to find out from their patients what they're currently doing with their behavior, how important it is for them to change that behavior, and how confident they are in actually making those changes. And so that's what we developed, is this physical therapy, healthy living, healthy lifestyle appraisal, or PTHLA. It's been exciting. It's new. It's exciting. There is nothing like this out there, you'd think, because it is so simple and easy to use that, but why wasn't this around before? And it's taken us a while to get there. Just the process of being able to validate a tool takes some time and rigor, and doing it correctly so that we have a valid and reliable tool. And that's what we have right now. So we're excited to be able to share this with other people.
Yeah, it's a nice evolution. I know Janet Besner started some of the earlier work in identifying the importance of health and wellness promotion in PT practice, or in our scope as professionals. And from there, obviously papers have developed and books, and clinicians are asking questions now. What can I do? How can I do this? It is interesting to me, you mentioned it earlier, that kind of the process that many professionals go through first is, can I do this? But really, where your tool comes in, once they check off that box, yes, I can do this, is how do I start to have this conversation with my patients? How do I breach this topic with my patients? And maybe you can talk to the importance of that, because so often it's like, well, I'm just going to tell a patient about how to optimize I'm going to tell the patient how to optimize their sleep.
Right.
But that may not be the best approach for health behavior change.
Right. So I think this really, that is the most important thing. And I believe, I mentioned to you kind of off recording, or before when we first met, was that I'm retiring from academia after a 31-year history in PT and PTA education. And I feel like the creation of this tool has sort of been like the bow on my academic career. And I actually am looking forward to continuing to do further study with this tool. I'll talk about that a little bit later on, but I'm not done with that. But I think that it is the most exciting aspect of my work in research and my scholarship here in academia. And I think that it's important to differentiate between I can tell my patient what to do. I'm the expert, and I know why it's important to make behavioral lifestyle changes with regards to, say, not smoking or getting adequate sleep. But it's all about how we have those conversations with patients. If telling people to not do unhealthy behaviors and to only do healthy behaviors worked by just telling them, we wouldn't have an obesity epidemic, and we wouldn't have chronic disease and so forth. So clearly that doesn't work. And so we need a different approach. And both Janet Besner and I have gone through coaching training, health and wellness coaching training, and to learn about the how to have conversations with patients. And it's about listening to them and letting them be their own, provide their own guidance, because nobody knows yourself better than yourself. And so it's about listening to them and then asking questions to help them think about all the reasons why they should change. So I think I've kind of missed what your question was originally, but I'm clearly very passionate about this, and think that it's about, and I tell this to my students all the time, is that this is, to me, this is the most important thing in being a qualified, effective physical therapist. You can have the best hands-on skills, know the best evidence behind your interventions, but if you can't communicate it and listen to your patients about what's important to them, none of it's not going to matter. So really, I hate this term, soft skills, but that is really, in my opinion, the meat of our profession and being an effective clinician.
I'd like to go into the specifics of the assessment and really kind of go through all the different parts and maybe speak about different components under each category there. But before we do that, because I want to make sure we acknowledge the team that you were part of and the team that you led. Oftentimes when we read things in the literature, it looks like, oh, this is just like a 5-page form with maybe 10 questions.
I know, so simple.
So simple, so easy, right? No stress involved in this.
Yeah.
But give us an idea of the process that you and the team went through to develop this PT Healthy Lifestyle Appraisal form.
Yeah, I can remember distinctly the three of us sitting in Dr. Besner's office in Texas, thinking, just saying, what do we want to ask? And so we started with what health behaviors should a PT be addressing with their patients? And we didn't have to arrive at that on our own. There was a well-documented publication led by Elizabeth Dean and her team on the outcome of the second annual PT Summit of Global Health. And I think that was like 2011, maybe. It was a while ago, maybe even before that. And in that paper, there are recommendations for the health behaviors that a PT should be addressing with their patients at all. It's like, it's like a given as part of all PT evaluations. So we started with identifying the behaviors. And then what we did is our goal was to have the most simple, basic tool. And we wanted to ideally use visual analog scales. So 3 rulers is kind of what our hope was, that we would arrive at a tool that had visual analog scales to quickly assess stage of change or readiness to change, importance, and confidence. And so what we did with the confidence is we compared validated confidence surveys. Some of them were as many as 20 questions long that pertain to each of our health behaviors that we were studying. And we used patients who were patients in an outpatient orthopedic clinics across the country, through 3 different areas across the country. And we had them, our original survey was 118 questions, because we were asking them these validated self-confidence questions and then having them also rate that using the ruler. And then we did the same thing with stage of change, using the standard validated questions about stage of change or readiness to change, and compared those to a ruler. And it took 2 iterations to get there. And eventually we came up with this 18-item survey that we are able to use a 3-item stage of change question, and then 2 11-point visual analog scales to measure confidence and importance. So it was a process of, we did pre-post tests with the patients in the clinic. We asked them to fill out the survey day 1, which was at any point in their PT episode of care. And then within about 2 to 7 days later, we asked them to fill out the exact same questionnaire, knowing that their behavior likely didn't change in that 2 to 7 days. And that we would just say, are they answering the questions the same way, to see test reliability. And then with a lot of statistical magic, we came up with, and were able to make the determination that these 18 items led to this, exciting new survey or questionnaire that would allow practitioners to learn about their patients' health and wellness, or healthy lifestyle, I guess.
So you went from 118 questions and chunked it down to 18.
18.
Which is important, because we know that patients become fatigued if they have too many forms to fill out. And sometimes someone's cognitive awareness or cognitive ability can be a challenge if there are too many questions or too in-depth questions. That's why I really like this, because it's simple, it's easy, and it's short. And when practitioners hear that, they're like, okay, I'll use that. Because when you have questionnaires and self-report measures that are start to go beyond probably the 30 question range, they're not really clinically applicable, but this is.
Right. And then thinking about the clinician, then the PT needs to read that and look at the patient's response and make sense of that. And it's because each of the 6 behaviors follow the same pattern. It's super easy to be able to say, and I'll talk about that in a minute here about like how I think the best way that this could be utilized within clinical practice.
So let's do that. Let's dive into this a little bit and tell me, let's just kind of big picture, tell us the 6 behaviors that are assessed.
Yeah, for sure. The 6 behaviors are physical activity, and we broke that down into both aerobic activity and strengthening. And we use governmental standards for what do we mean by that. So it's 150 minutes of moderate activity over the course of a week, and strengthening twice a week for most major muscle groups. So 2 of the behaviors relate to physical activity, strength and aerobic. We use smoking as our terminology. We actually had some conversations, should we look at tobacco use and include e-cigarettes? At the time we were developing this, there was still, CDC didn't really have a strong recommendation on e-cigarettes yet, as far as, is there any safe amount? So we just went with smoking. And obviously the governmental recommendation of that is don't. And then the healthy eating. And for that, we have in the survey, in the questionnaire, the PTHLA, it defines what do we mean by healthy eating. And in that we had at the time, the current governmental recommendations, which is what does a healthy diet consist of? And it's just like 5 bullets listed. So it's very general. And then sleep and stress management. And sleep was not about, we're not measuring number of hours of sleep. We defined healthy sleep as 7 to 9 hours for adults per the Sleep Association's recommendation. But what we're looking at is the behaviors that people are performing that can lead to healthy sleep practice. So it's very behaviorally based. What are you doing? So strengthening, moderate physical activity, 150 minutes, smoking, sleep, health, and stress management, and healthy eating are the 6.
So let's take one as an example so people have an idea of what this looks like and how it works. So can we start maybe with healthy eating?
Sure.
And I guess a good place is probably to read to people so they can, if you're watching, obviously you may see this, but read to us what the definition of healthy eating is in this self-assessment tool.
Great, that's a good place to start. So the healthy eating pattern is defined as eating the following foods regularly: vegetables, a variety of colors and types, fruits, especially whole fruits, grains, especially whole grains, protein, such as lean meats, poultry, eggs, beans, and nuts, healthy oils, such as olive and canola, and limiting consumptions of saturated fats and trans fats, added sugars, and sodium. So again, just really basic. And I think a lot, I hear from students, I hear from clinicians of, I can't talk about nutrition with my patients because that's out of my scope of practice. I can't prescribe diets. And clearly, as you read this definition, that's not what we're doing. We're looking at helping them see what is meant by healthy eating. And again, it's vegetables, eat vegetables, you choose, just do a variety. So yeah, I think that's really important.
Good. Yeah,
so that's the definition. Sorry.
Yeah, these are obviously stepping stones. Obviously, as PTs become well-versed in diet and nutrition, then they can begin to recommend different types of healthy eating patterns, dietary approaches. But these are really good, solid foundational recommendations and obviously conversation openers to have with patients.
Exactly. I think then that's the whole point of the PTHLA is to make it a conversation starter. I like that if you have the patient fill this out and you take the time to look at it, it's sort of just putting the door ajar of beginning to enter into that conversation. And you're right, if healthy eating is their primary interest and the healthy behavior that they're most interested in exploring, then you dive deeper into that.
Great. So you identify the definition for the patient or client up top. Mm-hmm. And then you have 3 questions below that to assess what seems like to me someone's readiness and where they are behaviorally with that behavior. Can you go through those questions so
Yeah.
people get a
Yep.
good idea of how this works?
Right. And as you said, it's the same 3 questions across all 6 behaviors. So it's very easy as I said, as the clinician, to be able to pop in and say, I just want to look at smoking or whatever. So the first question is readiness to change. And as many people might probably know, is that typically stage of change, the trans-theoretical model, has 5 stages. And in the development of this tool, again, we thought, we're not doing this for to look at outcome over time. We're not doing this for to look at, we didn't need to be as specific as those 5. So we consolidated those into 3 stages of change. So question 1 reads, select the one statement below that best describes your typical eating pattern as defined above. So look above. And option A is, I am following a healthy eating pattern. B is, I'm thinking about or have recently started to follow a healthy eating pattern. And C is, I have no intention of following a healthy eating pattern. So if you're familiar with the stage of change, let's start at C. C, I have no intention of following, is pre-contemplation. B is people who are contemplating or have started to take some action. And C is that they are actually living the lifestyle, performing the lifestyle behavior. And then question 2 and 3 are both a 11-point visual analog scale. Question 2 reads, please circle the number that reflects how important it is today for you to have a healthy eating pattern. Mm-hmm. And then they just circle a 0 to 10 on that. And 3 reads, please circle how the number that reflects how confident you are today that you can have a healthy eating pattern. So I think, to me, I think the most important question for a clinician would be looking at importance. Because if a patient responds that having a healthy eating pattern is a 9 out of 10 for importance, boy, they are telling you that they want to do something about their eating. And maybe they don't know how. I mean, that's the doors wide open for the PT or PTA to have conversation about, like, can we talk about healthy eating? What is it? What more do you want to do with that? How do you define healthy eating? That type of thing. Maybe it's just answering questions. That may be all it is. Or maybe it's like, I don't know how to, I love sugar or whatever. I don't know how to cut my love of sugar.
Right. So I think question 2 and 3 are both important, because obviously the importance tells you as a practitioner, okay, this may or may not be a critical part of my plan of care and be something that's valuable, or something the patient or a client sees as valuable to optimize their health and well-being. And then the confidence ruler, which is question 3. And again, each of the healthy lifestyle behaviors has this confidence ruler. Does that start to point us toward someone's self-efficacy with regard to the certain behavior in their life?
Mm-hmm. Yes, exactly. That's exactly it. And that literature supports that self-efficacy is one of the strongest predictors of initiating healthy behaviors and sustaining healthy behaviors. And that you may be highly self-efficacious in one health behavior of, for example, I never eat sugar. It's just my pattern, my habit, it's habitual. But regular exercise, I might feel really uncomfortable with that or lack self-efficacy in that area. And so self-efficacy is really behavioral dependent. And the way to help somebody improve their self-efficacy or confidence is in goal setting. In setting goals, appropriate goals for them, and getting this sense of accomplishment, because confidence builds upon itself. So again, being able to look at in your plan of care, developing maybe some goals around healthy eating. And it might just be kind of these small baby steps along the way.
Right. So of course, within this tool, there's physical activity, there's stress management, there's sleep. And you mentioned you break down physical activity into aerobic and strengthening, which I think is great, especially for PT practice. And then there's this section on tobacco use, which Rose Pignataro, who's a physical therapist and a PT educator, wrote the chapter on substance use or misuse in the textbook, Integrative and Lifestyle Medicine and Physical Therapy. And a lot of her PhD work has focused on tobacco use and other substance misuse conditions. Before we go into tobacco use, which is an important topic, and I want to discuss it, I just want to play devil's advocate for a minute.
Mm-hmm.
Is maybe in the evolution of this tool, would you see this category maybe being built out into substance use or misuse around
Mm-hmm.
things like opioids
Mm-hmm.
or other things that we're seeing in practice that are important for physical therapy outcomes?
Yeah, that's a great question. Whether it's, added to this, like use of chemical use, maybe would be, or if it's a separate category in itself. And I think that's the beauty of this tool, is if there are other lifestyle behaviors following this pattern of questioning, it can be used for any behavior. So that's a great question. And I think really is an opportunity to utilize this tool, expand the use of this tool into especially opioid use.
Yeah.
That's great. New thinking for me. That was wonderful.
Rose is an advocate for physical therapists helping people with tobacco cessation.
Mm-hmm.
Do you see us as having a role in that area?
Oh, I do. I do think that it's important to have literature or information readily available. If you begin to have conversation with a patient or client about ending their use of cigarettes, say cigarette smoking, and they express an interest in that, you need to be prepared for how to either refer them or what resources to provide them with. And so I think as clinicians, obviously we're well versed, we can talk about physical activity. Even sleep, I feel like is for many practitioners an area of comfort. Stress management, maybe a little less so, healthy eating. Smoking probably the least, in my opinion, where we as PTs are probably the least confident. And I know as an educator, DPT educator, not something that we spend a lot of time teaching our students about like, what do we know about substituting and other, medications for helping in the transition of stopping smoking.
Excellent. So let's go into the tobacco use section of this tool.
Mm-hmm.
So what's the first question up there that the patient would read?
Yeah. And I'll just start. The definition is tobacco use is defined as the use of any tobacco product, including cigarettes, cigars, chewing tobacco, snuff, or pipe tobacco. Question 1 is select the one statement below that best describes your tobacco use. A being I don't currently use. B is I'm thinking about or have recently quit using tobacco. And C is I have no intention of quitting tobacco. So C being a pre-contemplator, they're just not ready, but that doesn't mean that they might not be ready at some other point. And B being I'm sort of in this fence sitting place, is that, and they're the ambivalent folk, and they're the best and most prime for having conversation about behavioral change. And then the I am doing it, the maintainers, still there's opportunity, because relapse can happen at any stage of change, life circumstances, living in a pandemic for 3 years, there's a lot of things that can impact our sustainability with healthy behaviors. So even if a patient says that, like, oh, I'm not using tobacco, or I'm currently eating a healthy lifestyle, that doesn't mean that might not change in our course of episode of care with them, perhaps. And then there's same 2 follow-up questions of 0 to 10, how important is it for you to not use tobacco, and how confident are you that you can refrain from using tobacco?
Right. So there's always that importance ruler and the confidence ruler that are below those assessments there.
Right.
Who should use this, and should we use this with every single patient as part of our evaluation?
Yeah, good. Well, I think the who is clinicians, clearly, and I think educators. I think that there's a great opportunity for educators who teach health promotion, prevention, health promotion, and wellness within either a PTA curriculum or a DPT curriculum, to help educate or provide students with a tool that is so easy to use on their clinical experiences and in clinical practice. With the kind of like how often and who, our study was validated in outpatient orthopedic settings. And we think we did that because of the frequency of visits and within an episode of care. Typically in outpatient orthopedics lends itself nicely to be able to have that ongoing relationship and time to have these discussions. I don't think that it is unreasonable to consider using this in even an acute care or subacute setting. Again, because of its ease in use and practicality. And again, I think it provides the clinician with maybe a window into an aspect of the patient's lifestyle that we may not traditionally get through our typical subjective interviews or questionnaires, that intake questionnaires or outcome measures that we use. So I think in really any clinical practice, it has the potential. Pediatrics, probably not. So adult practices, and then in education too.
Yeah.
And I think, sorry, just one other thing. It's titled the Physical Therapy Healthy Lifestyle Appraisal. I think you could take off the words physical therapist there. And I think other providers in primary care, I'm definitely going to share this with my primary care physician. I'm like, hey, this might be something you might want to use to ask your patients about, because it's so easy and simple to use.
Yeah. Or OT practice or health coaching practice.
Exactly.
Or whatever.
Yes. Thank you.
So if I'm a physical therapist and I provide this to the patient fills it out. And let's just take tobacco use, for example. They circle C, which is I have no intention to quit using tobacco. Should I, as a professional, just kind of like box it up and put it on top of the shelf and say, oh, this person's not ready. I'm not going to talk about this, and leave it and not come back to it?
Yeah, I wouldn't recommend that. I think that the pre-contemplation, those that say I'm not ready or have no intention, I think sometimes the initial thought of the practitioner is they're a lost cause, they'll never change. And again, there's a lot of literature to support that, especially with smoking, those who have successfully quit smoking, oftentimes it's the frequency of conversations by trusted healthcare practitioners has an impact on the likelihood that one will change their healthy behaviors, particularly with smoking. And so, again, it's not having that conversation, it's about how you have that conversation. So it's a trusting healthcare professional who approaches it in a non-judgmental, it's your decision kind of a way, and comes back to it. So if I am a physical therapist and maybe I'm seeing this patient maybe every 6 months or something, every year, this person has some musculoskeletal injury that they come to see me with, I would ask that every time. And like, hey, 6 months ago, Joe, you said you weren't quite ready to quit smoking. I'm wondering how you're feeling about that right now. And say, and maybe it's like, they're a I can't versus an I won't kind of a pre-contemplator. Maybe the I can't is it's too big of a hurdle. And if you could tease that out, then it might be just through, did you know that there are some medications? Did you know that there are a lot more medications that can help with this process? Versus the I won't, which again, are not a lost cause. They're just not ready right now. So kind of looking at readiness to change as a continuum. At any point, you might move along that continuum.
Right. So this can be part of a conversation, let's say in follow-up treatment sessions, or you can reinsert it into a reevaluation process.
Right.
If it's part of that.
Yeah, exactly.
So MarySue, in a couple of months, you're going to, fortunately and unfortunately, retire from our great profession, because I just feel like when I read papers like this and talking about, integrative and lifestyle management, I just feel like we just need like 100 more of you in our profession. So I know you're not
hopefully exiting. We will.
Yeah, you're not exiting completely, but as you start to kind of sunset, and if you had a magic wand to wave, how would you like to see our profession utilize the physical therapy, healthy lifestyle appraisal in our profession?
Yeah, well, I love it. And my colleagues, Beth and Janet, would agree with me, I believe, on this, is that we would like this to be part of every initial examination. that it just becomes as important as asking about rating pain. That this is something that is just implemented into other standard outcome measures that are part of the medical record or part of your intake subjective history. And that from that then, of course, the results of this can't just sit in a chart, is that the clinician practitioner would look at that. And I would recommend that they begin to look at the importance scale and looking at anything that is highly important, and regardless of their stage of change. I think regardless of question 1, where they are on the stage of change, and maybe even regardless of their confidence, is the importance. If it's important to you, I would explore that so much. I was like, why, tell me why it's important to you. And tease that out. You'll learn a lot about the why it's important. I always think starting from a place of curiosity is the best place. And when we're working on behavioral change, it helps. I think it helps me as the clinician to stay away from being judgmental and really exploring it from a beginner's mind. Of like, I tell this story about a family member who smokes, and I've never smoked cigarettes, and asked my family member one time, like, tell me what you enjoy about smoking. I honestly don't know. And I learned a ton about what that did for their confidence and their ability to, have self-esteem. And so it was very interesting. And so coming at it from a place of curiosity can be really important. And I think that's what the importance question can help. And then if you see a discrepancy between it's highly important, but my confidence is low, oh my goodness, really ripe for having a coaching conversation, using some motivational interviewing, just empathetic listening, to be able to kind of bridge that gap between building the confidence to match how important it is.
Yeah, when I read this, I see there's a fair amount of shared decision making that happens with this tool, which is important. And it's also important for us as professionals to realize that we're not perfect in these categories.
Right.
And all of us struggle with healthy lifestyle behaviors, and even addiction, not just to tobacco, but to we're all addicted to something in life here. Food, sugar, our cell phone,
television,
Netflix,
social media.
Yeah. So all this, I read this, I'm like, I always feel like, hey, apply it to yourself first, then maybe to someone you feel comfortable with, and then you'll be ready to obviously use it. And it should be used. I'm with you. It should be used in every single physical therapy evaluation, probably across most of our disciplines.
Right.
There's some use for it.
Right.
MarySue, it's been great speaking with you. And again, we're going to point people to that paper. If people want to learn more about you and your work, keep up on it, or if they want a copy of this tool, how can they reach out to you?
Yeah, for sure. I'm kind of old fashioned, I guess, but through email would be the best way to reach out to me. And I'd be happy to you can get the article in the April Cardiopulmonary Journal, Physical Therapy Cardiopulmonary Journal. And my email address is there. I'll verbalize it here just if you want to jot it down or commit it to memory, that's great. And I will, if you email me, I will get you a copy of the PTHLA for your use. It's very available to use at no cost. My email address is ms Ingman, INGMAN. So MS Ingman at St. Kate, and that's STKATE.edu. And again, as I think I've said before, we'll say it again, but I'm super excited, thrilled that this tool is available for clinicians. The ease of its use will, I think you'll find appealing and easy to use. And I do believe that it will increase that therapeutic alliance between you and your patients. You're communicating, just by asking them to fill it out, you're communicating to your patients that you care about at least these behaviors. It's important enough for you to ask about it, and now you want to help them maintain the most healthy lifestyle that they can have, not only for to achieve their PT goals, but to live as a human being in this society.
Well said. So of course, all those links and MarySue's email can be found on the webpage at the Integrative Pain Science Institute. If you can't find that, just send me an email or reach out to me on social media, and I'll, of course, make the connection. so you can have that information. And if you're listening to this and you're a physical therapist who's excited about healthy lifestyle and ways to evaluate and intervene with effective behavior change, take a screenshot of this episode and tag me on Instagram at drjoetatta.com, and I'll be sure to tag you back. I'm Dr. Joe Tatta, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.